If you've landed on this video, I'm gonna bet that one of these two things is true. You've either got your celiac diagnosis, but you're still confused about what it actually means and what is actually going on in your body, because let's be honest, no one tells us, no one gives us any support. Or alternatively, the celiac in your life has sent you this video so that you can finally understand what they're going through and what it means to live with this condition. So by the end of this video, you'll understand what celiac disease actually is and how and why it can look different for every single person with the condition. Hi, I'm Ella and I'm the head coach and founder of the Coeliac Wellness Club, and this channel is all about educating you on celiac disease and how to live your happiest and healthiest life possible. So make sure to subscribe so you don't miss another video. So celiac disease often gets confused with gluten allergies and gluten intolerances, but it is neither of those things. It is an autoimmune condition. So gluten is actually a protein found in wheat, barley, rye, and spelt. And when a celiac ingests gluten, the body mistakes this protein for a deadly pathogen. So it thinks it's like a harmful virus or something else of that nature. So it completely misinterprets that gluten protein for something dangerous. And when we eat gluten, it actually gets digested in our small intestine. So when the body registers that we've had it, it panics and it wants to get rid of what it thinks is the deadly pathogen. So in other words, an immune response is triggered. It's doing everything it can to get rid of the gluten. So celiac disease is an autoimmune disease. It is not an allergy or an intolerance. So what's the big deal then? The body thinks gluten's a pathogen, can't be that bad, right? Well, this is what I thought when I was first diagnosed, because no one actually explains to you how serious the damage that happens to our body is when this immune response is happening. So I'm going to explain what goes on in the small intestine. So our small intestine is filled with these tiny finger-like structures called villi. Okay, and it's these guys' job to absorb all the nutrients from our food. The way they're shaped causes more surface area and more opportunities for nutrients to be absorbed. However, when the body is trying to attack the gluten, these guys get caught in the crossfire and become inflamed and flattened over time. So while the body's trying to attack the gluten, it basically just ends up attacking itself. And as you can imagine, the villi can't do a very good job of absorbing all the nutrients from our food anymore. So this is known as malabsorption. We cannot absorb the nutrients from our food. So we might eat things, but we don't actually get all the nutrients from it because our villi are damaged. They cannot absorb it. And this is quite dangerous because malabsorption leads to vitamin and iron deficiencies. And vitamin and iron deficiencies have a whole host of symptoms. So of course, because the damage and the action is happening in our gut, celiacs can get a lot of gastrointestinal symptoms. So bloating, constipation, diarrhea, and it's often why celiacs are misdiagnosed with things like IBS. However, because of these vitamin and iron deficiencies, the symptoms don't stop there, okay? It can actually impact our whole entire body because our body needs nutrients to function. So this is why celiacs also get symptoms like iron deficiency anemia. They might get hair loss, they might have skin issues, they might have neurological symptoms as well because it affects the brain, it affects our organs. And over time, the longer we live with this malabsorption, the longer we live with this damage and we don't know what's happening, the more serious things can become. So this is why celiac disease is linked to future health conditions like osteoporosis because we can't absorb enough calcium and vitamin D to support our bones. Or it's also linked to certain cancers and issues with fertility as well. So more often than not, people can live with this condition for years and years and years. And it actually takes an average of 13 years for us to get diagnosed. So for example, in my case, I was literally just talking to my dad today about the fact that when I was younger, I had eczema all over my body. You know, my teeth didn't grow properly. I was always craving very plain and dry food. So I was showing signs of celiac disease from when I was a little baby. And this went on to extreme fatigue. I had muscle aches, joint aches. You know, I had recurring infections and illnesses when I got older. However, I didn't get a diagnosis until I was 21 years old. And this isn't just the case for me as well. Lots of celiacs go undiagnosed for so long, and it takes, for example, a big health scare in adulthood to get their diagnosis. Or, for example, a lot of women may struggle with recurring miscarriage or infertility, and this is how they get their diagnosis. Because this is more than a tummy ache. Okay, this is more than just, you know, oh, I get a bad belly when I eat gluten. No, there are so many of us with a whole host of other symptoms. In fact, something that's associated with celiac disease is something called gluten ataxia. So this is actually neurological damage to the brain from eating gluten. So it is more than a gastrointestinal condition. And the problem and the reason why it takes so many of us ages and ages to get that diagnosis is because there are classical, stereotypical presentations of celiac disease. So things like stomach issues, and there's still not a whole host of awareness on the broad range of symptoms, the fact that there's over 200 symptoms and this can impact the whole entire body. So this is why so many people get misdiagnosed, or they just live with symptoms for ages before finding out what it actually is. And then you have people that go without symptoms for years and years. So asymptomatic celiac disease is a thing as well. Some people don't get any symptoms at all, but the intestinal damage is still happening when they eat gluten. So it's a very, very broad spectrum condition. There is no one size fits all. Everybody's experience is very, very different. But the good news is that celiac disease is treated with a dietary change. So we don't actually have to take any medication. We just need to completely eliminate gluten from our diet. So when we do this, the villi get a chance to rebuild. So they get a chance to grow back and they can start doing their job again of absorbing all of the nutrients from our food. So this healing process can take a different amount of time. Most people start seeing improvements within the first few months, but in lots of cases, this can actually take, a year plus as well, depending on how well that individual follows their gluten-free diet and, the extent of the damage in the first place as well. So how long they have been living with this condition. So something that I really want to highlight here is that the damage that we've mentioned, the immune response that we've mentioned, it can be triggered by even tiny, tiny amounts of gluten. Okay, so even just a couple of crumbs of gluten accidentally eaten by a celiac can lead to some of this damage happening and some of the symptoms that we've spoken about happening as well. And if somebody with celiac disease is frequently accidentally having tiny pieces of gluten frequently throughout their life, they may constantly feel unwell. They may never feel as well as they could have done if it was never in their life. So something that celiacs really, really need to look out for is cross-contamination. So I'm going to use raw chicken to explain to you what cross-contamination is. Okay, so if you cooked some raw chicken and you had it on your hands, imagine that you walked around your kitchen and you touched all of your surfaces. You wouldn't want to touch that again. You would be scared that that would go in your mouth. Even if it was the tiniest bit of raw chicken, you would not want to touch it. So imagine if someone, was sorting out their raw chicken, then they made you a sandwich or they put something on the same chopping board as the chicken and gave it to you to eat. That'd make you sick. That would give you food poisoning. It's identical with gluten, okay? If we accidentally have a tiny bit, so we might just touch bread and then touch something gluten-free, or you might, get some butter out of the fridge and butter your bread and then put the knife back in the butter and there's crumbs in the butter. This is where cross-contamination can happen. And this is why it's so, so difficult for celiacs, because if those around us are not being hyper aware about cross-contamination, we can actually live in a constant state of feeling anxious, feeling worried, constantly having to clean everything, constantly having to ask the people we live with questions. So if you are somebody that is watching this video because you are trying to learn how to better support somebody with celiac disease, I want you to always think, gluten is like raw chicken. I want you to treat it in exactly the same way. So this risk of cross-contamination is why celiacs need to be so hypervigilant when eating out, when choosing places to eat. And it's why as well they might not be comfortable eating at your house, because it's very, very difficult to completely avoid any cross-contamination whatsoever when you do have gluten in your kitchen. So if you invite a celiac around to your house and they don't feel comfortable eating, it's not because we're being rude. It's not because we are being fussy either. It's because, number one, we don't want to get sick ourselves. And also, we don't want to put you in a position where something that you've cooked makes us feel sick and then you feel really, really guilty about it. And if a celiac, mentions that they can't eat somewhere, it's exactly the same in that case as well. We have to be clever and careful when choosing places to eat, because at the end of the day, this is a really serious health condition. And we can't take things like cross-contamination risk lightly at all. If we get continuously cross-contaminated, if we don't adhere to our gluten-free diet, this can lead to really, really serious health complications in the future, and can also potentially reduce our risks of being able to have children as well. So please, please, please give celiac disease the seriousness it deserves. Obviously, it's absolutely fantastic that we have a dietary treatment for this disease. Hopefully in the future, something else will come along in medicine so that we can start eating gluten again. But from my perspective, I find it really useful to kind of be grateful that we don't have to take any medication. That's a really useful mindset shift that I've popped in place. But we've gone over what celiac disease is. We've gone over why symptoms can differ so much from person to person, and what you can do to support the celiac in your life as well. So if you have any questions, feel free to leave them in the comments. And if you're looking for any further advice and support around living your happiest, healthiest life with celiac disease, be sure to subscribe to the channel, and you can join the free Coeliac Wellness Club Facebook group as well, which is full of free resources to help you on your way. So thank you so much for watching, and I'll see you in the next one. Bye.